Hello, good day everyone. Thank you for reviewing my proposal. And today I'll be presenting about Mama Care. It is a mobile based health maternal support platform designed for emerging markets. And the goal is to strengthen communication, improving decision making during pregnancy, and reduce preventable maternal death. Today, I'll walk through the business model canvas, highlight the value proposition, explain the market demand, show improvements from week three, feedback, and justify the financing option best suited for this startup. Moving along, we have the challenge. The challenge is maternal health in emerging markets. So, what mostly affects women? We have the delays in decision making, lack of timely guidance, transportation barriers, which make it a challenge for women. So, these three critical delays contribute to maternal mortality in emerging markets, creating an urgent need for innovative solutions that bridge the gap between pregnant women and timely care. So, in many emerging markets, pregnant women face major barriers from delays in decision making to shortage of medical insurance. In Rwanda and similar contexts, three main delays contribute to preventable maternal death, which are the um, delayed decision making, delayed transportation, and delayed care at facilities. So our solution is to directly address the two of these, which is the communication and transport, by improving real-time information flow and emergency response coordination. Where also will be reducing the risk window that leads to maternal complication. So, about our value proposition focuses on reliability and safety. Mama Care provides expectant mothers with medically verified information, immediate access to healthy professionals, and rapid emergency transport whenever danger signs appear. So this solves the uncertainty pregnant women experience and offers familiar peace of mind. The value I clarified here reflects the feedback from week three, ensuring my value proposition is more detailed, customer centered, and clearly aligned with market needs. So, about our value proposition in deep is that our mobile app and the 24/7 hotline connect pregnant women with verified healthcare professionals for immediate guidance when emergency allies. Our integrated transport coordination system links with local clinics and community drivers for rapid response. Also, for the affordable continuous support and improved outcomes, through an accessible subscription model, mothers will receive uninterrupted access to health monitoring, danger sign alerts, and professional care. This reduces critical delays in decision making and ensures better maternal health outcomes in under-deserving communities. Yeah. So we move up to the customer segment. Who are our target markets? Who are we targeting in our Mama Care app? So our primary customers will be the pregnant women with mobile phones, also Lulo and underdeserved communities, whereas our secondary users will be families and caregivers, local clinics and maternity centers. So our initial customers are pregnant women in underserved communities where access to timely healthcare is limited. We also create value for their families who often make decisions about emergency care. Also, healthcare facilities benefit indirectly through reduced overcrowding, better coordinating referrals, and improved communication. This segment is essential for building pricing and outreach, for building pricing, outreach, and marketing strategies. Yeah. So, moving on with the business model canvas overview, as you can see, we have our key partners, our key activities, the value proposition, the key resources, the customer relationships, the channels, the customer segment, and the revenue streams. So this is an overview of our business model canvas. I will walk through the components briefly, highlighting improvements made from week three, especially by adding more depth in the areas of activities, partnerships, and financial justification. So, as I said earlier, our key partners will be the clinics and hospitals, NGOs, and health organizations. We also have community drivers and mobile networks. About our key activities is the app development and updates, 24/7 hotline operations, emergency coordination, community outreach, whereas our value proposition are the reliable market health information, the 24/7 access to nurse and midwives, the danger to sign alerts and reminders, also the first emergency transport coordination, whereas the we have also the revenue streams where we'll have low cost subscriptions. We also pay per consultation. We also have partnerships with NGOs and insurances. Yeah, as I was saying, our core activities span both technological and operational functions, which is the app development, hotline services, and emergency coordination. These are supported by strong partnerships with health facilities, community drivers, and mobile network providers. Feedback from week three emphasized the need for more detail in my partner activities. So I expanded this by showing how each partner contributes to service reliability. Resources including medical staff, IT staff, and content creators, all critical to delivering the service safely and consistently. Yeah, moving on with the financing strategy and justification. So, our financing strategy is impact investment plus the health innovation grants. So, our financing approach balances social impact with scalability, combining impact investment with grant funding um, to ensure sustainable growth while maintaining our mission-driven focus. Why does this type of financing strategy fit with mama care? It's because mama care solves a high impact health problem. It also aligns with the third SDG, which is good health and well-being. Also, it grants reduced risk in early stages. Also, have impact investors support scalable social ventures, and it also provides capital for tech and medical staff. Yeah. Moving on with uh, our competitive advantage and partnerships, it is that our competitive advantage comes from the way Mama Care integrates three critical services into one accessible platform. Real-time maternal health information, 24/7 access to qualified nurses and midwives, and rapid emergency transport coordination, while many solutions focus on only these areas such as telemedicine or ambulance services. Mamacare combines all of them, making it a comprehensive and reliable support for women. So another key advantage is that our localized approach by partnering with nearby clinics, community health workers, and trusted local drivers, we create a support network that is familiar, culturally aligned, and highly responsive. These partnerships not only reduce emergency response times but also build credibility within communities. So, also collaborations with NGOs, government, healthy programs, and mobile network operators further strengthen the platform, allowing us to expand quickly and reach the undeserved operations, partnerships, and integrated services to create a competitive edge that is difficult for new entrants to replicate. Yeah. So a call of action is for this type of health tech startup, early stage funding is essential, especially because app development and medical staffing require capital for before revenue begins. So impact investors are ideal because they look for ventures that combine that combine the financial sustainability and the measurable social benefits, such as maternal deaths. Additionally, health innovation grants, such as maternal health innovations, funds or digital healthy grants to reduce risk and support pilots. Yeah, and we would like to call you all to join us and to choose us because the Mama Care will be a very good platform for the ladies, and you won't regret choosing us. As for the differences, and as a conclusion, Mama Care addresses a critical gap in maternal health communication. This platform strengthens decision making, connects women to medical expertise, and coordinates emergency transport with scalable technology and strong partnerships. The business is positioned to achieve both economic and social impact. I invite potential partners and investors to support the pilot phase so we can begin maternal health outcomes in emerging markets. Thank you.